now that we finished your physical exam, I'd like to discuss a few things regarding your overall health. Did you know that a considerable portion of cardiovascular events like heart attack, stroke, aneurysm, and heart disease can be attributed to poor adherence to high blood pressure medications? And your best chance at living a long, healthy life is to take your medications and eat a healthy diet? You mentioned today, when we were talking today, that you've become inconsistent with taking your high blood pressure medication. Can you tell me why that is?
My blood pressure is more controlled, so I usually just reduce the dose myself. And I've been feeling great the last couple weeks, so I'm not sure if I really need to take it anymore, Doc. And I found that if you take a lemon in your water, it's supposed to help. I've also been taking these medications for like 30 years, and I'm just fed up taking them. Sometimes I just feel like I don't have time for it. I've got cows to feed and corn to
I understand that you're feeling frustrated, and it's totally normal to be feeling that way. The great news is that for the 31 years that you were taking your high blood pressure medications, your risks of heart attack, stroke, aneurysm, and heart failure have been significantly reduced. It's important to be consistent with your high blood pressure medication in order to keep your risk of having a more severe event low, even if you feel better or if your blood pressure readings are lower. Because, remember, that is the effect of taking those medications. Your blood pressure readings are lower because you're taking the medication. As for your diet, there's many small steps that we can start with to get you on the right path and in the right mindset that don't require a large time commitment.
I just don't know, Doc. Seems like too much of a change right now, and I don't need that in my life.
Your blood pressure is quite high in the office today. I'm concerned about the damage that you may be doing to your body. If the numbers alone don't scare you, what would tell you that it's time to make a change?
It's just not the right time, so I don't even feel sick. Thanks for your help.
Okay, now that we're all caught up, I'd like to bring up again what we discussed at your last visit. You still aren't taking your blood pressure medications consistently, and I noticed that your blood pressure is a lot higher this visit than it was at your last visit. I know we discussed at the last visit how important it is to take your blood pressure medication consistently in order to prevent more severe problems from developing. Last visit you mentioned your frustration with how long you've been taking your high blood pressure meds and the difficulty in changing your diet. But is there anything else standing in the way of taking your medication consistently?
So I've been thinking about this a lot, Doc. My cousin had a heart attack just last week. And the doctor says because he wasn't keeping up with his high blood pressure medications. I'm not really ready to die or have a heart attack, so I want to hear your ideas for how I can do better and to be healthier. With my medications, I'm just worried that I'm going to have to take these pills for the rest of my life. And with my diet, I just don't always like to eat healthy. And it's expensive.
I'm very sorry to hear about your cousin, but I'm glad that you've come to that realization that it may be time to make some serious changes. It is never too late to make positive changes for your health. Let's discuss a plan that will work best for you. So what could get in the way of you making these changes?
My main problem is I forget to take my medication during the day, and when I don't have it right beside me, it's even harder. And like I said, eating healthy is just too much work and too expensive.
Okay, so for your medications, let's find something that works for you. Patients often find it helpful to pick things that they do every single day and take their medications simultaneously while doing those things. For example, since you have to take your medication 3 times a day, you could take one with breakfast, one with lunch, and one with dinner. And you can get a small pill holder to carry it with you in your purse or whatever, so that you always have your medications with you. For your diet, what would you say is your worst habit?
So I get fast food like 3 times a week, and I don't really have time to cook.
Do you like to cook? Is there a day of the week that you could try to dedicate a few hours to meal prepping some healthier foods? That way we can aim to reduce the number of days you get fast food. And if you had healthier meals ready to go in your fridge, would you be inclined to grab those in a rush rather than fast food?
I do like to cook, and I just bought an Instapot. So I guess I have some free time on Sundays after church, and I could maybe use it. I guess I could try to cook some healthier dinners with it, and that would help me for when my weeks get busy.
Great. I want you to try this plan that we've developed for 6 weeks, and then I'll have you come back in and we can discuss how it's going, if you're having any challenges with implementing the plan. Sound good? And I have some brochures with steps towards healthier eating and cooking that I can give you on the way out.
Yep, I think 6 weeks is a good start.
Okay. It is good to see you again.
Great
Tell
to see
me
ya.
about how these past 6 weeks have been for you.
You know, I've been doing really well with taking my medications consistently. I got a pill case that has morning, afternoon, and evening slots, so I make sure I take them 3 times every day. Your idea to take one with each meal has been working for me because now I associate eating with taking my medication.
That is great. You should be really proud of yourself. I noticed that your blood pressure is back in the normal range this visit. So the numbers prove that your hard work is paying off. How have the changes in your diet been going?
Not so well. I've been trying to buy some frozen meals to eat instead of fast food, but I still haven't had time to meal prep healthier foods.
That is a great step in the right direction. It is normal to have some hiccups along the way when trying to make long-term changes for your health. Maybe meal prep is not the right plan of action for you. Maybe now you can focus on finding frozen foods that are wholesome, healthy, and nutritious, all the while fitting it into your busy life. Keep up the great work. Good to see you again. You look great, but tell me how everything's been going.
So far, so good. I take my pills regularly with my meals, which has actually become second nature. And I feel better. I try to check my blood pressure every once in a while, and it's the normal range for me.
That is awesome. You've come so far and are doing amazing with that. I'm very proud of you. How has the diet been? I know that's been an obstacle for you.
Yeah, that has definitely been an obstacle, and I have had days where it's easier to just eat fast food or eat an unhealthy frozen meal like pizza rolls or just something easy, but I have tried to get better with it.
Honestly, you're headed in the right direction, and there will be times that you relapse and go for the easier option. But I can see that you're really trying to make a difference, and for that, I am impressed. You just need to keep working at it, and I know that you will get there.
Thanks, Doc. With your encouragement and plan, I know that I will get there, and I just want to thank you.